Dr. Paul Mason. PCOS, while genetic, can be helped with a keto-style diet to improve metabolic health. Myoinositol and folate as supplements may also help.
Polycystic ovarian syndrome is a condition, a genetic condition, we believe it's genetically associated, that's got three main diagnostic features under what we call the Rotterdam criteria. The Rotterdam criteria is atrocious. It is very unreliable, but it's still what we use. So we look at whether there's cysts on the ovaries. We have a look at whether there's high levels of testosterone or what we call evidence of hirsutism, hair on the face, or male pattern baldness, or acne, or basically anything to do with testosterone excess. And we have a look at menstrual irregularity. So whether the periods are just really not coming very often, or their cycle is very variable. And we generally say that if you've got two of the three, then you have polycystic ovarian syndrome. And that's, I think, doesn't reflect the complexity of the disorder. I believe it's on a continuum, and I believe people have degrees of it, and they might only have one of those symptoms, but definitely have it. The problem is polycystic ovarian syndrome is strongly associated with insulin resistance. So a lot of females who have PCOS, they're trying to lose weight with one arm tied behind their back. For them, they will generally be heavier on a particular diet than somebody without PCOS would be. And that's important to understand, because it means that, yes, it's not fair, but it does explain why these people might have troubles, and they know that they just need to be more diligent, and it sort of gives them an understanding of why they might be having troubles with their weight. And the best thing you can do for polycystic ovarian syndrome is actually improve your metabolic health. We often see levels of testosterone dramatically fall when people go on ketogenic style diets after with a diagnosis of PCOS. There's another supplement which is quite useful, and it's called Myoinositol. And there's several studies that show that can be beneficial, and that can just overcome one of the particular deficits within PCOS. And a dose of 2,000 milligrams twice a day is what's usually studied. And I believe they also throw in 400 micrograms of folate as well. So that's certainly worth, for people with polycystic ovarian syndrome, have a chat to your doctor and see whether it might be worth supplementing with myoinositol combined with a little bit of folate.
Polycystic ovarian syndrome, PCOS, is believed to be a genetic condition that can be evaluated using the Rotterdam criteria. However, Dr. Mason tells us that this is very unreliable. The Rotterdam criteria involves 1, evaluating whether there are cysts on the ovaries, 2, whether there are high levels of testosterone, and 3, whether there are menstrual irregularities. And generally it is said, if you have 2 of these, then you have PCOS. Dr. Mason tells us this approach doesn't reflect the complexity of the disorder. He believes that it is on a continuum, where even if you just have one of those conditions, you could still have PCOS. PCOS is strongly associated with insulin resistance. Females with PCOS have additional challenges losing weight. The best thing to do is to improve metabolic health. PCOS is strongly associated with insulin resistance. We often see testosterone dramatically fall when the patient goes on a ketogenic style diet. Also, patients can supplement with myoinositol and folate. These have been shown to be effective, and Dr. Mason suggests that you check with your doctor.